Welcome everybody to the Sonoma Strong Virtual Healing Fair. My name is Sherry Pedrioli, and I am the founder of Holistic Choices Incorporated and the co-founder of Sonoma Strong Healing Fair. Holistic Choices and Sonoma Strong Healing Fair are both nonprofit organizations that provide our communities with education, free healing fairs, compilation books, referral directories, all to assist you in exploring your choices in alternative and holistic healthcare. If you'd like more information, please visit our website, www.sonomastronghealingfair.com or choicesbookseries.com. I am so thrilled tonight to have one of our local doctors talking with us about the holistic overview of COVID-19, which, as we all know, is kind of the topic, right? So anyway, if anybody has any questions, please leave them in the chat box and we'll address those after the presentation. So right now I am actually going to turn this over to Dr. Daci, and she'll let us know a little bit about herself and what we're going to hear from her tonight. So thank you so much.
Thank you. Thank you for joining us, everyone, tonight. So I'm very thrilled to be here and be giving this talk. I'm going to share my screen. I have a few slides, and please feel free to post your questions on chat. And I will leave some time at the end to answer your questions. Okay, let's see if this works. There we go. Okay, so my name's Daciana Iancu. I go by Dr. Daci, and the question is, what qualifies me to be giving this talk? Well, so I've been a physician for 22 years. I initially worked for Kaiser for about 18 years, working as a hospitalist and primary care physician. I've been studying and practicing integrative medicine since 2004, initially within the Kaiser system, incorporating it into my practice. And then 2 years ago, I started my own integrative medicine practice. Also, since this COVID-19 epidemic, I have been working in telemedicine for one of the largest online platforms that do telemedicine and virtual healthcare appointments. So I'm seeing patients from all over the country, and I've been seeing about 60 to 100 patients a week, most of which come in with questions about COVID-19. So I've had a little bit of frontline experience now on this and been doing my own research and incorporating my integrative and anthroposophic medicine knowledge into this talk. So hopefully this will give you a different perspective. So I've tried to add a few things that are a little bit maybe not spoken about as much in the media. So that to give you kind of a more comprehensive look at what's happening. All right. Whoops. All right, so some facts about COVID-19. Most of you know these numbers already, but I just wanted to put up the numbers. There are currently 554,000 in the United States, and there are 21,942 deaths. So this is why this is a big deal, obviously, as you all know. So first, when is COVID-19 infectious? So according to literature, and this is, well, some of this is kind of obvious also from practice, is that it seems that the COVID-19 is most infectious during symptoms. But it can be infectious also before symptoms develop, in the days 1, 2, 3 before symptom development, although that risk is pretty small. It's 6%. Well, they're relatively small. But we are most infectious during symptoms in pretty much in any illness, and it's the same true for the coronavirus. And the infection is mostly transmitted through the aerosol droplets from the nose and mouth. However, an interesting fact is that most people stop transmitting the virus through these droplets after the first week of infection. So one may be ill with the infection and still have, may still be ill with the infection like 10 days out, but they not necessarily have any virus in their droplets. Also, the virus can live on surfaces for up to 6 days, and this is on surfaces that have not been cleaned. So another factor that's important in the infection is the amount of virus that one gets. So that's why all these measures of prevention, like masks and hand washing, are enforced right now. Because when somebody sneezes in your face, you're going to get a lot more virus than if you touch a box, like a UPS delivery box, for example, that's been sitting for a while, that comes to your house. If somebody sneezes in your face, you're going to have a lot of droplets with a lot of virus and a higher viral load, and then your chance of becoming infected is much greater. So one needs about 10 million copies of the viral RNA in order to get infected. And that's a lot of virus. And that's why the risk of infection is much greater in close contacts, like in household or healthcare workers, because they just get exposed to a lot more dose of the virus. And how severe is the illness? Well, for most people, it's not that severe. 81% develop only mild symptoms, but when it's severe, it's bad. So 5% of people develop critical illness, which means that they could end up in the ICU and they could die. So the fatality rate is about 2.3%, but everybody who dies is really among this 5% in the critical illness. And sorry. So 81% have mild symptoms or no symptoms, and then 14% have moderate symptoms. And these are usually people who have cough and colds and some trouble breathing, and more symptoms. We'll go over it later. And then again, 5% have severe illness, and the mortality rate among all varies from country to country. So currently the estimate is about 2.3%. In China has been between 0.7 to 5.8%. But when they looked at it retrospectively and they counted all the people that were tested and they correlated it with the time when the illness developed, they figured out that the mortality rate was only about 1.4%. In Italy, the mortality rate has been the greatest. And then in South Korea, where they did a lot of testing, it was the lowest. Okay, so a few other things about the virus. Again, 18 to 50% of the cases may be asymptomatic. And this is really based on the studies that were done on the cruise ships, where pretty much everybody was infected. Everybody was exposed. Only some people were infected, and even people who were infected, they were found to be asymptomatic. Another fact is that those who get really ill from this infection, the vast majority of them have other comorbidities. Asthma. Many people feel like asthma puts them at increased risk, but according to all the medical literature, is not listed. So what are the symptoms of COVID-19, of the illness? Well, okay, so these symptoms were really based on people who were hospitalized and people who tested positive. And I'm not convinced that they really represent what we see in the community. But according to medical literature, the vast majority have fever and fatigue, and then dry cough, and then lack of appetite, body ache, shortness of breath, sputum production, smell or taste aberration. So a lot of them lose their sense of smell or taste, which is a temporary loss. And other less common symptoms may be headaches, sore throat, runny nose, and GI symptoms like diarrhea and nausea, abdominal pain. Now, I say this is based on the medical literature. What we're seeing in the community on the virtual platform is that fever is not necessarily always a presenting symptoms. A lot of times people have cough and body aches and this interesting chest pain or shortness of breath, symptoms that are just a little bit different than what you really see most of the time with colds and flu. It just has a different flavor. So what's the core of the illness? Well, many only have mild respiratory symptoms like a cold or the flu, and that's why often is written off as just being a cold. And it may last anywhere between 2 to 3 days to 7 days, sometimes a little bit longer. Some with initially mild symptom may progress to have worse symptoms over the course of a week. And what we're trying to figure out right now, it's determining that around day 5 through 7 is when people tend to get a little bit worse. Whether they progress to severe illness or not, these days 5 through 7 seem to be the worst day. And a very interesting fact about this virus is that people who are completely asymptomatic, they have no symptoms whatsoever, have been found to have lung findings on CT imaging and chest x-ray, but primarily on CT imaging of these ground glass opacities, they're called. And that basically says that there's some fluid in the lungs. And this is a picture which basically the black area is the lungs on both sides, and those areas should be kind of black with just maybe a few of these white lines through them, and those are the lungs. But here, these white spots that you see are accumulations of fluid in the lungs. And this could be somebody who has absolutely no symptoms. So that makes it very interesting. And those who develop severe illness is because their organs really get severely affected. So the lungs is the primary organ that gets affected, and the lungs fill up with fluid. And what happens, the acute respiratory distress syndrome, is when there's so much fluid that even using a ventilator, doctors cannot push enough oxygen into the lungs, because it's like trying to push oxygen or air through a barrier of fluid. Some can get blood clots that can damage the organs. There's an inflammation of the heart muscles that can occur, liver failure, kidneys can be affected as well. So there's like a cascade of things that happen when one becomes severely ill. And I'm happy to answer more questions if you want to put them in the chat about this, but I'm not going to go into too much detail. So what causes the COVID illness? Well, many believe it is the virus, but the virus is not a living thing. Like I mentioned earlier, it can live by itself only for a few days. It really needs another organism in order to exist. So what happens is the virus gets into the body and it infects the cells, and that's how it survives. It's because it uses our body and our cells to survive. But as it gets into our cells, those cells become strangers to the body. And then the body says, oh, stranger, all right, let's take it down. And so the body mounts this immune response. It sends a lot of immune cells to try and clear out these infected cells. So the symptoms of the illness are not because of the virus, but because the body's response to the virus. And this, when it happens, is not because there's too many viral cells that are causing the death, but rather because the immune system responds to the virus, and it over responds to the virus, and it causes all these inflammation and the blood clots and the fluid accumulation that leads to death. So when critical illness develops, again, it's due to complication from the inflammatory response, which affects the organs, primarily the lungs. And what happens is the immune system releases the cytokines. There's these little guys, which are chemical messengers of the immune system, and they're the ones that cause most of the symptoms. It's a little more complicated than this, but this is like the simple version of it, is that the cytokines cause the fever, the body aches, the fatigue, the headache, the diarrhea, and they can also cause direct organ damage. So why does the immune system overreact in some people and not in others? And that's the million-dollar question that nobody has a clear answer for. Well, some theories are that if the immune system is suppressed, then it can't really self-regulate appropriately, and it's going to overreact. So I see it a lot in people who develop some of the more severe symptoms, is that they take Tylenol around the clock. And when one takes Tylenol, it suppresses the fever, it suppresses the body natural defense mechanism of fighting this illness. And then the immune system tries to mount a stronger reaction because it's being dammed up. Out of shape. What I mean by that is the immune system being out of shape. So our immune system out of shape? We are so afraid of illness that we constantly try to avoid it. We don't like colds. We don't like to get sick at all. And a lot of it is driven by the workforce, because employers do not like it when people stay home sick. So, so there's this culture of not being okay to be sick. But when we're sick, when we have a cold, when we have a flu, the immune system mounts a response, which is a small to moderate response. And it's like working out for the immune system, and it gets to be stronger. It gets to exercise its ability to release the certain cytokines in just the right amount. So it's working out. Are we too cold and sclerotic? So an inflammatory reaction is hot. Everything's hot. Our body gets hot. It's inflammation. It's all heat. So what I mean by cold and sclerotic is that as we get older, we get colder and sclerotic. Our muscles get more sclerosed. Our joints get more sclerosed. Our arteries get more sclerosed. It's just a normal process of aging. We're cold because we are so much in our heads. There's not a lot of heat in our bodies because we're not very much in our bodies. We're on our screens, we're intellectuals, we like to read, but we don't really spend time being in our bodies very much, connecting with nature, connecting with each other. And this is relative, of course, but compared to how we used to be 100 years ago, we're much more kind of like lifted up of our bodies in our heads and just kind of colder. So then if we live in this constant state, our immune system, when faced with a challenge, the immune system is already kind of cold, is it trying to overcompensate by mounting this really hot response that's out of proportion to what's needed. These are theories, and you can think for yourself if these sound like fit. This is more the way scientists used to think before the time of the bacteria was introduced, like during the time of Pasteur. And there was a complete shift in thinking at that time. And now a lot of the scientists are starting to go back to those ways of thinking and wondering, asking questions. Another thing that comes up is, are we overburdened by toxins? So if we constantly have to clear out pesticides from our bodies and plastics, and we're dealing with Wi-Fi, and not to mention like just emotional stressors, is our immune system overburdened and doing that job and does not really know how to deal with viruses and bacteria anymore. So the bottom line is, the question is it the virus that causes the illness, or is it the environment? Is it the fact that our bodies have this environment that is not ideal, and when a reaction comes in, we are overburdened with other things and don't know how to deal with an illness like this. And if we think about the fact that most people who have chronic illness are the ones that really end up dying, is their bodies, their environment in the body is taxed. They're on a lot of medications, and they're already dealing with trying to balance and manage a lot of issues in the body. And then you add one more stressor, and it's just too much. So how can we prevent the COVID-19 illness? Well, we want to nurture the soil and clean the environment, so that being our bodies. Although, you know, our greater environment is always a reflection of our own internal environment. Rhythm, warmth, and hygiene. I'm going to talk about each one of them further. So rhythm. Rhythm has to do with the way our bodies hum in rhythm. So if you think about it, our heart is in rhythm, our breath hums in rhythm, the liver digests and processes nutrients on a rhythm, on the daily rhythm. There's certain times of the day when we digest better than others. So our whole body and all of our organs is like a symphony. They all hum together in a very specific rhythm. And the organs that are most associated with rhythm are the lungs and the heart, for obvious reasons. And these are the organs that get most affected by the virus, primarily the lungs, but the heart also. And so how can we support rhythm in our bodies? Well, we can become more in tune with the circadian rhythm of sleeping and waking, going to bed at a reasonable hour and waking up about the same time every day, and making sure that we get enough sleep. So rhythm of sleeping and waking, work and rest. And if you've been overworked, like most people, you probably know that the more you work, the less efficient you are. So we really need that balance between work and rest. Sitting and exercising, eating and fasting, and more evidence is coming out now about the importance of fasting, the overnight fasting, but also fasting between meals. Thinking and feeling. So again, as I mentioned earlier, if we're constantly in our heads, that kind of excarnates us out of the body, and feeling our emotions helps us bring us more into the body. So this balance between thinking and feeling is another way of maintaining rhythm in our bodies. Warmth. So the virus does not like warmth, even though they really, Italy's warm. And well, why did it happen there? It's more complicated than that. But there's a few studies that suggest that the virus dies at a temperature of 104. So warmth is one of the ways we can not only nourish our bodies, but also prevent the infection. So bodily warmth. And that means staying warm, making sure that we wear enough clothes. So when we're warm, our immune system functions better. And in the olden days, we knew this. There's always the saying, oh, don't stand in a draft or put your shoes on. And a lot of that has been lost in today's culture. But warmth is really important to our health, and especially to our immune system, physical warmth. And then emotional warmth. Again, the virus affects the organs that are most associated with emotional well-being. So we need emotional warmth. And it's kind of ironic that during this time when we really need the emotional warmth and the support of our community, we have to stay away from them, well, for good reason. But that's why it's really important to nurture the emotional warmth during this time, whether it's via Zoom, phone, saying hello to your neighbor from 10 feet away at least, but just still connecting with people and maintaining the emotional warmth and the connection. And sunshine. We're very lucky here in California. Just standing out in the sunshine is really beneficial. It's beneficial to our endocrine organs. It's beneficial to our well-being overall. I mean, you all know that just standing in the sun for a few minutes, close your eyes and letting that sunlight just come into your body, it can be just incredible. Like, it really helps your system regulate and go more into parasympathetic mode, and it just feels really good because it's good for you. All right, and hygiene. So hygiene, now you all know, and it's very well now in terms of washing your hands and cleansing surfaces and all the things that you need to do to prevent the virus from spreading. But here I want to go into something that is not really well emphasized right now, And that's like just a personal hygiene in terms of diet, thinking, so body, mind, soul, and spirit, basically. So in terms of diet, how do you prevent the virus and how do you maintain health? And that's eating a clean diet, of avoiding sugar, alcohol, eating seasonally, so eating vegetables that are in season now. It's springtime, so it's still important to cook a lot of the vegetables and not eat just raw vegetables. And then also bowels too, like it's important to have regular bowel movements to keep that digestive hygiene. And environment, if we constantly have to clear out toxins from our body, that taxes our body more. So maintaining an environment as much as possible, clean of free of pesticides and household chemicals, knowing where your water comes from, using filtered water, and then Wi-Fi. And there's many of you may have seen, there's a lot of talk about whether or not the 5G may have contributed to this. And I don't know that actually anybody really knows. There's a lot of studies pro and con on the effects of Wi-Fi and on our bodies. But that is something to consider because it's another external toxins in some ways that affects our bodies. And the weaker we are, the more we have to deal with, the harder it's going to be. So if really clean, then maybe we're not really affected by Wi-Fi, or if there are other things, like if you get enough sleep or you're not as stressed, then that may not affect you as much. So it's very complicated, and everyone's situation is very unique and different in how they are affected by these things. And then hygiene of mind and thinking. Are we, ruminating over the news? Are we on screens trying to keep up with everything that's going on? Or can we make room for that to go away and to get some rest from that? And hygiene of the emotions. And, when things come up, what do we do about it? Like, do you have somebody that you can go to? Do you have a therapist you can call? Do you have a friend? How do you deal with the emotional toxicity that builds over time? And then spiritual hygiene. And usually that means that tends to often fall on a side, maybe, like when we're too caught up with the virus and not really doing our practice or our study, or not connecting with community. But the beauty of this, as we're finding out now, is the service aspect and how many people are responding with service, which is part of prevention. It's really good for our souls to be in service. And so it's got a double advantage. And then what are some supplements and remedies for prevention? So plants that strengthen the immune system and particularly are good for the lungs are the elderberry, astragalus, licorice, cordyceps, and rhodiola. So elderberry or licorice actually are more specific for the lungs, and then the astragalus and cordyceps and rhodiola, they're just kind of overall tonics. They support your adrenals, but we really, as many of you know, we need the adrenals to be strong, which really, they're all interconnected, which helps our immune system be strong. And then vitamins and supplements for immune support: vitamin C, vitamin D, zinc, resveratrol, melatonin. Melatonin is one that just some studies are coming out and showing how it's helpful against the coronavirus. So if you are stressed and have trouble sleeping, that may be something that could be helpful in both prevention and treating what's going on. And the melatonin actually can be in pretty high doses in terms of prevention for the coronavirus. Well, anthroposophic medicine is my passion, so of course I'm bringing some of that in here. And in Anthroposophic Remedies, we really use, for prevention, we use those substances that bring in light. So again, from this way of thinking, the virus does not like heat, does not like light, it likes cold and dark. So by bringing in elements that bring in more light into the body, then that's a great way of strengthening the body to not get succumbed to the illness from the virus. So those elements are iron, phosphorus, and quartz. And these are some remedies: meteoric iron prunus and meteoric iron quartz, or ferrum phosphorus. that can help with prevention. And if you're interested in these, you can contact me and I can tell you more about them. I did not want to add too much specific to this because it's going to be posted online, and I don't think it's a good idea for people to just self-medicate with these, but I'm happy to answer any questions. Another remedy is Primula onoportum or Cardiodoron, and this is a remedy that's made of 3 plants, and it really helps support the heart and the rhythm. So since the virus affects the rhythm aspect of our bodies, this is a nice support remedy. And it also helps with stress, which is another benefit given the stressful times. So what do you do if you get the COVID-19 illness? Well, as I mentioned earlier, most people have mild to moderate symptoms and illness, which can be managed at home beautifully. And this is where alternative and integrative and anthroposophic medicine, they have a lot to offer as opposed to Western medicine. In Western medicine, there's really not a whole lot we can tell people to do. But you know, in integrative medicine, there's a lot you can do. So you know, call me, call your integrative practitioner, call your Chinese medicine doctor, because there's a lot that the integrative community can do to help manage the COVID-19 at home and to prevent people from having to go into the hospital. So some basic things that you can do at home is Dr. Diet, Dr. Quiet, Dr. Merriman, and I hope you like my picture of Dr. Diet, Dr. Quiet, and Dr. Merriman. So for Dr. Diet, obviously clean diet, like I mentioned earlier, but also bowels. So really keeping the body as cleansed as possible. So having regular bowel movements, whether you need to do a glycerin suppository, you can take some magnesium, smooth move, prunes, whatever it takes to have 1 to 2 to 3 bowel movements a day. At the onset of illness, the first thing you really want to do is cleanse your bowels. And then, you know, don't put anything that's difficult to digest, that's more damning, like dairy, sugar, proteins into your body. Just eat a clear diet, mostly vegetable soups, clear soups. That's like the best thing you can do. Lots of tea. Dr. Quiet, rest. And this is understated because in today's culture, when we say rest, most people think, oh, great, I'm going to I can sit on the computer or I can watch movies because I'm not doing anything really. But no, rest means staring at the ceiling, like lay in bed and do nothing. Try to sleep as much as possible, create a nice environment of warmth and quiet where you're undisturbed, and really go through the illness process. It can be transforming. The kids are just like the most amazing, because when kids go through illness and they just sleep through it and you just see them transform before your eyes. But the same thing happens for us. So rest is really important. And then Dr. Merriman, which really means warmth, warm bath, warm environment, warm interactions. So we all know how wonderful it is when you're sick and a loved one comes in and says, oh, can I bring you a cup of tea? Or maybe I can cover you up. So this warmth interaction just nurtures our soul, which in turn just nourishes our body. And fever. Again, fever is really important. It's your body's best defense mechanism against any infectious illness. It's built in, it's natural, it's what we're meant to do. So when we get sick, we mount a fever. So I have seen, again, I'm not sure if I mentioned this already, but the people who get the most ill with this illness often, they're taking Tylenol around the clock. And then ibuprofen has been shown to not interact well with the virus at all, even though it's an anti-inflammatory, and this is an inflammatory reaction. But no, do not take ibuprofen, do not take Motrin, aspirin, and really try to avoid Tylenol as much as possible. So one thing I haven't mentioned here, if you're having a lot of body aches when you're ill, a nice trick is to do some arnica. You can take the arnica pills, you can take some arnica solution or gel, and you can put it on your temples for a headache, the back of the head, and whatever you're having body aches. So arnica is a nice remedy, and also taken internally. For fever, there's the Apis belladonna. It's also an anthroposophic remedy. which you can take to help lower the fever. And I'm happy to talk with you more about this. And then there are lemon compresses. And if you, in my references, there's I'm pointed out at the end where you can learn more about lemon compresses and how to manage fevers at home. Herbal supplements. So again, elderberry, licorice, and Chinese skullcap. These are the herbal supplements that are really well suited for the coronavirus that affects the lungs. And then another one that is N-acetylcysteine, and this helps with all the mucus formation in the lungs. And a common supplement that is available over the counter, you can buy it online, and it's still available in stores actually, is this Dr. Murray Lung, Sinus, and Bronchial Health by Natural Factor, and it has the N-acetylcysteine in it. And a lot of the local stores will sell supplements like tinctures that have the elderberry, the licorice, and the Chinese skullcap put together. And on my website, again, I have an article where I mention where locally, if you're from Sonoma County, you can find these tinctures at the local pharmacies. Okay, and then anthroposophic remedies that are helpful if one develops the COVID-19 symptoms and are being treated at home. These are the Sabadilla eucalyptus, which is really nice for respiratory symptoms, Petacetus platago, Cardiodoron, or Primula onocordum, difficult names to say, Gelsinia bryonia. So yeah, ask me, call me, I'm happy to help. These are sold at this Uriel pharmacy, but these are wonderful remedies that can treat pneumonia even. It can treat bronchitis, it can treat any kind of lung illness. Just beautifully at home, and it's been so wonderful to just see people get better without having to resort to any heavy drugs often. Not always, sometimes we do need the antibiotics, but many times these can do the trick. So the question is, when do you go to the hospital? Well, I recommend that you call your doctor. So most physicians' offices are offering some kind of telehealth or virtual visits at this point. So don't go in, you probably can't anyway, but so calling a doctor is a nice way of checking in. Is it time? What do I do? I'm worried. It's wonderful. The recommendations are not to go to the emergency room right away for multiple reasons. It's always good to check in with somebody. The emergency room doesn't really want you to go in. They want you to call ahead. Many times they'll meet you outside or in the parking lot. They'll do like a screening, because if you are infected, they don't want you to go in and infect others. And if you're not infected, then you're going to be exposed. So when do you go to the hospital? Well, obviously, if you can't breathe. And this is a tricky one, because people say, well, I don't really know. Like, I'm a little bit short of breath. Like, when is it like really bad enough for me to go in? And there's not a very straight answer. I mean, so the people I'm seeing, they're having some mild shortness of breath. It just feels like, wow, you know, I can't quite take in as deep of a breath as I usually can, or just my breathing feels different. And then it's probably a little bit of fluid in your lungs, but it's not very serious. Your body can handle it, and you're fine to stay home. But if you cannot speak in a full sentence, that's the time to like really consider going in. And if it's worse than that, if you're really short of breath and you cannot speak a few words without having to catch your breath, then you really need to call somebody or go in and be looked at. So this is coming from the CDC, like when does one go to the hospital? And it looks like they are pretty waiting to almost until the last minute. But the recommendations are to, you know, when you have persistent pain or pressure in the chest, which again, a lot of people present with some pain or pressure in the chest. But if this is like so painful that you can't breathe because every time you take a breath, the pain is just excruciating, you should go in. And then the last three are really quite extreme. I'm hoping that most people will go into the ER before these last three develop, which is confusion or inability to be woken up or bluish lips or coughing up of blood. And coughing up the blood, again, it can be tricky. And this is why, like, you know, call your doctor. If you can call and have a phone appointment is important, because sometimes you may have a little bit of blood tinge in the sputum and it may not be serious. And sometimes it's more serious. And you really need a professional to speak with if there's any question about this. All right. And then another question that, you know, has been coming up, and I'm seeing it, people are thinking about it everywhere, and it's been on my mind a lot as well. And the question is the coronavirus a new evolutionary upgrade? So the coronaviruses have been with us for centuries, and 8% of our DNA is made up of viral fragments. The novel RNA codes are spreading from human to human. So you get a little bit of, so this virus comes in, and as I said, they cannot live alone. They mix with our cells. So they combine with our own cell, and then you have viral fragments and our own DNA within a cell. And then we cough, and somebody else gets a little bit of our DNA. It's very interesting. So we're really sharing genetic codes among each other. Is that what's happening? I don't know. I mean, there's a lot of research that's just, I don't know that there's a lot of research, but there is some research that's starting to look into this. And it's very interesting. So are we getting new genetic information because of this virus into our DNA? I don't know. It's very interesting. And here's a list of my references. And for fever treatments, the Anthroposophic website is a great resource in terms of what to do when you have a fever, lemon compresses. And then the last reference is the article that I wrote on this, which lists the local places where you can buy some of these remedies and herbal supplements. All right, and that's it. Let's see if there are any questions. Okay, no questions on chat. Okay, anybody wants to go live with any questions?
You have a question in there now.
Okay, so why no Tylenol? So, well, two main reasons. So Tylenol is very hard on the liver, and some say, so it really helps our, it interferes with the glutathione in the liver, and then your liver is not really able to clear the toxins out of the body because it's taxed from the Tylenol. So that's one reason. And the other reason is because it suppresses your fever. And as I mentioned earlier, you really need the fever in order to fight the infection.
And how could they get a hold of you? If, do you want to give them your website?
Yes, I'm gonna put my website in the chat box, but yes, you can reach me at anthroposophical.com. And there's a way you can contact me there. My phone number, feel free to call me. I'm happy to answer questions. And yeah.
Okay. Thank you.
My pleasure. Thank you, everybody, for coming back.
Thank you, Dr. Dasi, for all that wonderful information. A lot of it I'm not aware of and I haven't been able to find on the media. So this was great for you to share that with us.
I'm glad to hear it.
So I'm Diana Borges. I'm the other co-founder of the Sonoma Strong Healing Fairs. And this is our first virtual Sonoma Strong Healing Fair, but we've held 3 in-person fairs before. And the first one was in 2017 when the wildfires came through Sonoma County and a couple of the other counties nearby. I want to share with you our contact information. So I will just tell you, it's not coming up right now. So our website is sonomastronghealingfair.com. And if you go to that, you'll find all the information about the current virtual healing fair, and you'll also see information about the previous fairs. The email to contact Sherry or myself is info@SonomaStrongHealingFair.com. And we also have our Facebook page, Sonoma Strong Healing Fair. We are offering each day in April a presenter, and today we had actually two, and on April 25th we'll also have two. The presentations are either 8:30 in the morning or 7 o'clock at night, and that is Pacific Daylight Time. Tomorrow night we're going to be having Deb Meyer, who's a Jin-Jitsu acupressurist, and she'll be showing us techniques to help heal, release. And she also has wonderful animated videos that for adults and for children. So we invite you to go check out at SonomaStrongHealingFair.com the list of our practitioners and see if any of those resonate with you, and join us again. And for those that are watching the replays, all of those are going to be listed on our YouTube channel, Sonoma Strong Healing Fair, but you can find access to it also through our website. So I thank you everyone for joining, and a special thank you for Dr. Daci for your wonderful presentation.
My pleasure. Thank you for having me.
Thank you.
Goodbye.
Thank you so much.